welcome to Living Healthy on Remo TV, a program set to inform you about every aspect of your health. And today we are going to be talking about a pervasive topic which is mostly overlooked, which is called hypertension. So we are going to be understanding more about hypertension and how it is a silent threat or a silent killer to people. Moving forward, my name is Olushola Moyoluwa, and as I've said before, we are here to talk on hypertension. So first of all, what is hypertension? Hypertension simply means a force on the body or on the wall of arteries which bring much more pressure. So when your blood pressure is high, definitely you are hypertensive. Or when you get to know that you have blood pressure, high blood pressure. So when you know you are hypertensive, it simply means that you have high blood pressure. And what is high blood pressure? High blood pressure is when we have two different things we use to calculate high blood pressure, and one is the systolic and the second one is the diastolic. So when your systolic is 140 upward and your diastolic is more than 90 upward, you tend to have hypertension. And what is the normal blood pressure? The normal range of blood pressure should vary from 90/60 to 139/90 or lower than that. So that is the normal range of blood pressure. And what are the complications of blood pressure? Why should we worry about hypertension? Hypertension has a whole lot of complications, and number one is heart disease. Hypertension can really affect your heart disease, and your kidney also can be really affected. It can cause acute kidney injury or chronic kidney disease, which is also known as CKD. And most of the time, chronic kidney diseases are always secondary to hypertension, meaning that hypertension was the major effect of you having a chronic kidney disease. Another complication of hypertension is liver disease. You can have liver disease, and one thing that is always said is when one part of the body is affected, every other one are actually also affected. Now, who are those people that have hypertension? Actually, different people at different range can have hypertension, but according to research, most people from the age of 30 to 79 are actually those ones that are always highly hypertensive, and 46% of these people don't even know that they are hypertensive. And most of the hypertensive people really comes from the middle or the lower age, like lower range of life. When I mean lower range of life is when we talk about the financial income of the country. So when we are in the middle class, like we Nigerians, we are in the middle class of a developing country. So most people in Nigeria, according to research, like 1.2 billion of people in Nigeria are hypertensive, and 46% of those hypertensive people don't even know that they are hypertensive. So what are the risk factors of hypertension? Age, number one. Family history, it can be genetic. Hypertension can be genetics. So if you have a generation, like from the past generation, that is hypertensive, it's likely possible that you might also be hypertensive. Another one is your lifestyle change. When you live a sedentary lifestyle, you tend to be hypertensive. So please try to exercise, try to live your life, and try to be free. Don't just sit down in a place 24/7. Try to walk around just to prevent hypertension. Now, how can we manage hypertension? Hypertension can be manageable. You can choose not to be hypertensive. You can literally choose not to be hypertensive. Even if you have a family history from the past, you can choose not to be hypertensive. You should live your lifestyle the way you are suited. Don't overstress yourself. Stress should be reduced. Try to sleep well. Try to rest well. Try to eat balanced diet. And one major cause of hypertension is high sodium intake. And when we talk about high sodium intake, we talk about high health, like salty intake. When you take too much of salt, please, why are you pouring salt in your food? Why? So when you take too much of salt, you tend to be hypertensive. So please try to reduce your salt intake. Drink a whole lot of water. Please, at least 3 to 4 liters per day is actually very, very good. Drink a whole lot of water. Exercise well. You necessarily don't have to go to the gym before you can't exercise. You can just walk around, do some joggings in the house, do some little exercises in the house before like going out for your daily walk. And I've said before, try to rest well. When you rest, try to create a sleep pattern that you can actually keep following up. Please, I know we are trying to hustle around, but we can do it in this Nigeria that we are in, because everywhere just jama, but still please try to rest. Is very, very important. Sleep and rest is very important. And again, if you know that a generation of you, like maybe your parents or your grandparents, are hypertensive, please do try to monitor it. You can literally walk up to any health clinic around you and check your blood pressure. It's something simple. Or you can literally buy what we call the digital sphygmomanometer. They sell it in literally every pharmacy around you. You can get that and try to check your blood pressure. The machine will literally tell you if your blood pressure is high or low. Or you can even try to make a research. Okay, when is my blood pressure low? When is my blood pressure normal? When is my blood pressure high? So that when you try to check your blood pressure, you get to know if it is high or low or in the normal range. And again, when you get to know that you are hypertensive and it doesn't tend to come out, it can literally be a cause of a disease that you don't even know that you have the disease in you. So try to walk up to any hospital around you. Let them run different tests for them to know the main cause of like the hypertension. You can be having a kidney disease that is causing a low outflow of your sodium in your body, and when the sodium is retained in your body, you get to be hypertensive. So you can be having like a kidney disease or any other underlying conditions that can cause hypertension. So please try to walk up to any health clinic when you notice that your blood pressure is very high. And what are the signs and symptoms of high blood pressure? The signs and symptoms of high blood pressure is just simply headache, dizziness, night sweats. So when you get to notice all of this, or when you do a little walk and you get weak, or you do a little walk and you get dizzy, or you do a little walk and you notice that you have a blurry vision, those are signs of hypertension. So kindly walk up to any health center around you to check, and please try to keep your health very well. Health is wealth. When you lost it, that's when we know how valuable your health is. So please try to take care of yourself. And in conclusion, eat well, rest well, exercise well, talk to people around you. Talking to is a therapy for you to relieve stress. You might be going through a whole lot, you might be thinking a whole lot. So try to talk to the right people, please. And also avoid harmful substances. Too much of alcohol intake too can cause hypertension. So please try to reduce it. I'm not saying you should not take alcohol, but try to reduce alcohol intake. There is a level of alcohol you should take per day, and not even every day, because it can actually damage a whole lot of organ in your body. So stay tuned on Living Healthy on Remo TV, and you can also follow us on our website www.remotv.com.ng, and you can also follow us on our social media platform, on Instagram, on X, on YouTube, and on Facebook at Official Remo TV. Please keep your health healthy. See you next time. Bye.